Hi everyone, welcome. I am Dr. Dilsora Fozilova, and we will continue our conversation on sociology of health and wellness. In my introductory courses, I like to talk about Michel Foucault's concept of biopolitics, discipline, and control, and how that relates to sociology of health. So, what is Michel Foucault's biopolitics? Discipline and control of health and body. Michel Foucault offers two major concepts that are very essential understanding of modern health and wellness. The first one is discipline, how institutions shape individual bodies. And the second is biopolitics, how governments regulate populations through healthcare or health, through policies in the healthcare system. Together, these ideas show that health is never just biological. It is deeply tied to power, control, and social regulations, which he calls biopolitics. So let's go through quickly the discipline. So discipline is controlling individuals' bodies. So discipline is form of power that works on the individual body to make people productive and obedient and efficient and normal, if you will. According to Foucault, modern societies discipline bodies through institutions like hospitals, schools, prisons, military, workplaces, and clinic. So how do they discipline human body? And then you can think like, how do they discipline human body through these institutions? So these institutions teach individuals how to sit and stand and work, sleep, track their steps or calories, monitor their weight and blood pressure, avoid risky behaviors, for example, be efficient, self-regulating subjects. In this framework, the body becomes a project to be managed, not natural entity. Health becomes moral duty for society. People feel pressure to be fit or thin or mentally balanced or productive or constantly improving or normal. While we don't really know in sociology what is a norm, we just keep seeing this word, the term normal, used in different aspects of human life. What is normal mental behavior and what's mental illness, for example? What is normal human body, and in what point we start considering that as overweight or too thin? When do we know that? And of course, there are certain ways of measuring that, like body height and the fat we have under our skin. Perhaps there are some ways to measure it, but it doesn't mean that is, from every perspective, the certain way of being is normal. Normal can be different for everybody. So this is not neutral. It is a form of social control. So what is biopolitics? Biopolitics, in the basic way of understanding biopolitics, is managing population's health or managing population health. While discipline focuses on individuals, biopolitics focuses on the larger groups or populations. Foucault uses biopolitics to describe how governments manage life through or manage society through healthcare policies, vaccination campaigns, sanitization and hygiene systems, reproductive rights or reproductive policies, public health surveillance, like we have all different kinds of surveillance we go through every year or every second year, epidemiology, risk assessment, healthcare education programs. Those are all of them part of the government's program of controlling and managing human life. The goal is to produce healthier citizens, stronger workforce, for example, lower mortality, controlled fertility. We know that if people have less than one or two kids, or let's say the fertility rate is lower, that we cannot have enough people for Canada. So we have to rely on immigration, for example. So those are parts of biopolitics. How biopolitics relate to health. Health becomes a political and economic issue, not just personal one. Governments and institutions intervene in how many children people have. The China's one-child policy for a while, that can be very clear example of that. Or after World War, the governments were paying families who are having children to encourage having more children because World War II took the lives of many people in the world. What they eat, how people exercise, where they live, what diseases are monitored, or how pandemics are managed, also which bodies are valued or neglected. So this is another interesting topics on eugenics. As you know, the whole study or whole aspect of eugenics. We can give some examples of how indigenous women were sterilized because their children had less value for colonizers, for example. Or in the World War II, that Jewish people were, the oppressed or put into very dire conditions because they were considered as not valued body. Somehow there was an ideology that told people they are outcasts. It's like they are not what society wants. We need to get rid of them, right? So biopolitics is about regulating life on a mass scale, which discipline is regulating life in more individual level. So if we put the discipline and biopolitics together, Foucault shows that modern power operates in two levels. Discipline that controls individual's body, diet, exercise, medical checkup, self-tracking, health lifestyle pressures in society, or body image. Those are individual pressures or individual way of controlling human life. Biopolitics, on the other hand, it is healthcare funding, vaccination policies, pandemic lockdowns, food guidelines for children or elderly, health surveillance, reproductive rights. They are in a major area. Like it's a major or massive way of regulating population. Individuals regulate their own bodies because society expects disciplined, healthy citizens. And the state manages population or population's health for economic and political reasons, political stability. So, what does it mean for health and wellness? So, health is a site of power. It is not just about biology, it's about shaping behavior, controlling risks, and producing compliant citizens. The body is socially constructed as something to be constantly improved, that wellness culture, for example, that fitness, dieting, biohacking, mindfulness, those are all over the place in internet today, that mindfulness videos and dieting tricks or how to lose 50 pounds or whatever. So can be understood as internalized discipline. Public health policies regulate populations, as we mentioned, even neutral sounding measures like dietary guidelines or vaccination schedules or disease surveillance are actually forms of biopolitical management. It is like not, they are not naive, they are not innocent, they have this biopolitics in them. Not all bodies are treated equally, that is also part of it. Biopolitics explain that some populations are overly observed or surveilled, for example, racialized communities. Others are under protection, like um, so some people are maybe not surveilled enough, their health is not surveilled enough, or they don't have the means to, the get, the prevent themselves from having too many children in different parts of the world. Those are like poor and marginalized groups. Certain illnesses are prioritized while others are ignored. Healthcare, the mental health was one of those areas ignored largely for some time. So the health or healthcare becomes moral responsibility in society. People feel guilt or shame for being sick or overweight or stressed, as if they failed in their duty to manage their bodies properly. So, in short, Foucault for Foucault, health is never purely personal. It is shaped by disciplinary forces that train individual bodies and biopolitical systems that govern populations, revealing how power operates through regulation and life itself. So, this is a very short review of biopolitics. I will see you in our next videos.